and so Tom didn't ever have very much to work with as far as placing an implant.
Okay.
So we used a computer system.
After you chastised him for that.
Well, nah. Tom's a good guy. We'll treat him okay. But anyway, the interesting part about that is we could then use that computer system and that information from the CT scan and actually use a computer program to determine how much bone we need, where the implant needs to go, and what steps are necessary to actually create that. And that's we actually have a slide of that also. So once that plan is made, then the implant was placed, and this picture is actually a picture of the implant in place. The bone graft is already done, and Tom leaves like this. He's got a little screw at the top of his gum. Doesn't hurt. How'd it feel afterwards?
Didn't know it was there.
Which is ideal, right? That's the whole point.
It's perfect.
Okay. And then what's next?
So then what we do is we take off that little screw device and we actually place a thing called an abutment, which is a piece that allows us to attach a crown to the implant. And then we put a crown on top of the implant, and basically he's got his tooth back. And Tom hasn't been finished yet, but I have a picture of some crowns that we've done on top of implants, and you just look at them and you think, oh, those are just teeth. Because that's the goal, is to give you back teeth. People don't want implants, they want teeth.
Right.
And so the end result is we give them teeth and everything's fine.
No one would be the wiser. It does sound like this is a bit time-consuming. Is that pretty much the only disadvantage to considering this procedure?
Yeah, it takes a little longer, but the nice part about it is that the speed of growth of bone around implants is increasing faster. It used to take 6 months. Now a lot of these procedures can be done in 3 to 4. And it really depends on the body's ability to heal. If the person heals very quickly and the bone grows very quickly, then we can place the crown on sooner. In some cases, we can actually place the implant and put the crown on that day, but because Tom didn't have any bone in that area and we had to create some, that wasn't possible.
How's the whole process been for you? Other than the fact that it does take time and multiple appointments, how's it been for you?
It's been great. There's been virtually no complications, no issues, no discomfort, and it's been great.
And no more atomic fireballs, right?
And my wife has told me no more atomic fireballs.
Okay, that makes it certain. You can tell yourself, but when the wife gets involved, it becomes a little bit more concrete. How much longer is it before he's completed?
I think Tom's got about another month, don't you? And then we can actually do the final restoration.
August,
okay.
All right, well, maybe you can come back in, we can see that, and we can color coordinate a different color shirt.
That would work.
All right.
Yeah,
the blue worked good on Friday, right?
The memos got out, didn't
they? Exactly. Got out around to the right people.
Perfect.
Exactly. Of course, you have a website for people to learn more if they want to explore not just this procedure, but other ones in your whole practice, right?
www.reallysmile.com.
And we're going to link that to indystyle.tv.
Great.
Good to see you again, Doctor. Thanks for coming in.